Morning, everyone. Give a quick update on Genesis Health System. Our COVID hospitalized patients has been running in the 30s throughout the week, relatively stable. We haven't really seen a decline, but we haven't been increasing either. Our biggest challenge has been in our ICU patient population. Over 50% of our ICU beds have been occupied with patients with COVID-19. The challenge with the patients in the intensive care unit is that they're very sick. They require a high level of care, and they're having stays in the intensive care unit that tend to be weeks, not days. So intensive care unit's a challenge. That leaves less than 50% capacity for us to take care of all the other things that we have to take care of in our community that require a critical care level in our ICUs. So that's been a pressure point for us. We've intermittently had to work within the region to transfer patients when we do not have capacity to care for them at Genesis. We've partnered with Unity Point on that, the University of Iowa, Peoria, and sometimes we have to go outside of our region even to find appropriate level of care for a patient. So intensive care unit continues to be a pressure point for us. That's been a recurring story when we see increasing COVID-19 cases throughout the pandemic. And again, it tends to be the last place that we see the surge let up because of the long length of stay for those patients. What I'd also add is that, overall, our hospital volumes are very high, not just COVID, but all the other things we take care of. We're running more than 20% above what we would expect for this time of year. COVID represents probably 10% of that volume above normal. And that's certainly putting a strain on our resources. We are, like most organizations and most healthcare organizations, we are short staffed in areas, but we work to make sure we meet the patient need. But I wouldn't simply say this is a short staff challenge. This is really a challenge of the volume of COVID patients combined with all the other care that we have to provide in the community. I would also add that we continue to work on our vaccination efforts. We're working on that with our patients in our primary care clinics. We still have walk-in vaccination access, which is readily available in the community through Unity Point and our pharmacy partners. But our message is we continue to promote vaccination. We continue to promote wearing of masks indoors, both for children in school and for adults when we're out in the community. And we of course, we're masking at all times within our own facility here in Genesis, as is our partner Unity Point in the community. So that's my overall general update for Genesis Health System. Please wear masks when you're out indoors in the community, and we encourage everyone to get the information they need to make a decision on being vaccinated.